Okay, good afternoon, everyone. We are glad you can join us today for this important talk by Dr. Calyn Tan on overcoming COVID-19 with the big P to understand the why and to know the how. Now, before we begin, there are a few housekeeping lists to listen to and also to follow, so please pay attention to them. Yeah. Okay, so this is especially for mobile users who are joining us for this talk through Zoom. Yeah, in order to hear us, then you need to select the join audio button. Yeah, so let's go through step by step on how to do that. So first, you need to tap on your screen once, and then the taskbar will appear at the bottom of your screen, in which you need to select the join audio function, which is the first from the left. And then you'll need to select the function Wi-Fi or cellular data. And after you select it, then it will change to the unmute function. Then the Zoom host has actually muted all who are joining the talk in the beginning, yeah, to ensure that there are no unnecessary distractions from participants. Okay, so please take note of that. Okay, and so we would like to ask for your cooperation not to unmute yourself throughout the talk. Okay, so we shall allocate a time for you to do so, to unmute yourself during the Q&A, the question and answer session, which will happen after the talk. So if you have any questions to be answered during the Q&A session, so you can choose either way to post your questions. There are two ways, yeah. You can either type your question down in the chat box, or actually you can ask your question directly, which is verbally, okay? So let's go through the first one. For those who are joining us through the Zoom meeting using your desktop, if let's say you have some question, yeah, actually during the talk, you can actually type in your question already. We will take note of that. So you can type in your question into the chat box. So you will see that at the bottom of your screen, there is a chat button, yeah? And then once you have clicked on the chat button, then you will see a chat box appearing at the right side of your screen. And that's when you can start typing in your questions. Then for those who are joining us through Zoom with your handphone, then and if you want to type in your question, there's a few steps you need to do. Yeah. So first, also tap on your screen once, and the same thing, the taskbar will appear. And right on the right side, the more function button, you can select that. And then once after you select that, then another interface will appear, and that's when you can select the chat button. So, and then you can type in your question. And after you have typing in your question, you'll need to press the send button. Yeah. After that, you have to press the close button in order to bring you back to look at the screen which we are sharing. Okay. So for those who opt to ask your question verbally, yeah, which we will open this time to everyone after the talk during the Q&A session. Now you can put the raise hand function, okay? Now when we say about raising hand function, it's not like you have to turn on your video and raise your hand to ask the question, yeah? Yeah, that's another way to do that. Okay, for desktop users, yeah, in the Zoom meeting, you first, if let's say you can use your voice command to say raise hand, okay? And make sure also you need to unmute yourself, yeah, before you can say that, okay? All right, and for mobile users in Zoom, you have to click on the more button as well, and then you select the raise hand function. And also remember to unmute yourself also, so that you can ask the question verbally. All right. That since we talked so much about Zoom users, how about those who are joining us from Facebook? How do you put in your question? That actually you are only able, for those who are joining us through Facebook, yeah, you are only able to type in your question. There's no raise hand function, or you're not able to actually ask us verbally, yeah. So you can only type in your questions. So, but you can do so during the talk, and we will also take note of your questions. Yeah. So, but we also would like to remind everyone, due to the limitation of time, we can only pick a few questions to be answered during the Q&A session. Yeah, but please be rest assured that all the questions that we pick for Dr. Calyn Tan to answer will be beneficial to all. Okay. Okay. And lastly, just need to remind everyone that no recording is allowed for this talk. Yeah. But please be rest assured that we are doing recording for ourselves. We will be doing the recording ourselves. And also we will be uploading this video for those who are not able to join us today, or maybe for you who would like to listen to the talk again. Yeah. So what you can do is that you can go to YouTube, yeah, type in Banting Chinese Methodist Church and subscribe to this channel. And also maybe you can click on the notification to say that if we have uploaded any new videos, then you'll receive a notification. So you can try to check into our channel so that to see that if we have already uploaded the videos, then you can share the link to your friends for those who are not able to join us today, or maybe also for yourself. Yeah. Okay. So, all right. So we are done with the housekeeping rules. So allow me to introduce myself. I'm the moderator for today. My name is Eileen. Yeah. So, and before moving on to the main event today, let me briefly introduce the speaker to everyone. Dr. Calyn Tan is working as a medical doctor, specializing in public health, and has been working in the public healthcare system for 11 years. And she's a passionate health advocate who thinks creatively, and she enjoys learning from the experiences from people from all walks of life. Besides her career, she's an active member of Banting Chinese Methodist Church. So being an artistic and creative person as she is, she finds inspiration through traveling, photography, videography, and poem writing. Yeah, so without further ado, let us pass this time to Dr. Calyn Tan.
Okay, so very good afternoon, everyone. Thank you for the kind introduction by moderator today. Thank you, everyone, for taking time to actually join this talk. I won't term it as a talk, I will term it as a sharing. And just a short story before I start this sharing. Actually, the motivation behind this sharing starts from this story whereby I work in the hospital previously with a lot of patients, and patients are actually really my best teacher. So I really get to know their story, and it really helps me to motivate me to understand them better and to do better for them. So for this talk, right, actually I'm thinking on the perspective of all of us come from different backgrounds. All of us see things differently. All of us do things differently, and our perceptions are shaped by our environment and what we see and what we learn, our family upbringing. So this talk is to help you guys maybe understand something from the perspective of the healthcare side. What are we talking when we are saying about COVID-19 and what this P is actually about? And I'm sure that a lot of you want to know. So it's just to help you guys to understand the why and to know the how, so that you'll be able to process whatever that you're seeing and whatever you're doing at the moment as we're fighting this pandemic together. So, okay, so I would like to start with this slide. So when you look at this word of SOP, right, and all these things that is on the screen, right, I'd just like to give a few seconds perhaps to you guys. What do you actually think, or what do you actually feel about it? So you don't need to answer me, you can answer it by yourself. So what do you actually feel about it when you look at the word SOP and you see all those things? Does it feel like, do you feel like numb? You know, it's just something that I do it every day and every day. I'm tired of seeing at it. I'm tired of looking at all those things. Or do you feel like it's something that we still need to do? Or do you feel like it's something which is, it's so general, I can just, it's at the end, the tip of my fingers, I can just say it out. But do I actually know what am I doing? So we very well be experiencing what we call pandemic fatigue. If you're seeing the word SOP, right, and you're feeling like, yeah, it's just nothing, it's just something which I need to do every day, but I don't feel like there's a need to do it. And what is this pandemic fatigue actually? Pandemic fatigue actually happens, it's a term actually coined by WHO. It happens because we are in this unresolved adversity. We are in this pandemic for such a long time. We may start to feel demotivated. We may start to feel very hopeless, and we start to feel like we don't really want to do those SOPs anymore. And it is very real, and it can happen to us without us actually knowing and realizing that we are actually in the form of a pandemic fatigue. So if you realize, and if all of you remember, right, the first COVID-19 case in Malaysia is actually on 25th January 2020. And looking back, it has been about 1 year, 4 to 5 months that we have been fighting this pandemic together. I'm sure that regardless of whether you're in the front line, regardless of whether you're a working mom, or you're a stay-home mom, or you're a working adult, or you're a student, actually all of us face this pandemic differently. Maybe some of us may be facing it, feeling it more than another, but every one of us has a different experience with this pandemic. And it's okay to acknowledge that we are feeling tired of it. It's okay to acknowledge that we have these feelings of hopelessness and insecurities and worries and fear. But it doesn't mean that we do not still need to do what we need to do. So I have done COVID-19 in Malaysia has the invisible enemy. So why is it invisible? Because it's just something that we couldn't see. It's an enemy that we have been fighting for so long. It doesn't feel that there's going to be an end to it. And it actually does not discriminate. So if you see, right, it actually can affect anyone, whether you're young or old, you're a male or female, you're adult children, whether you're working, not working, where you're staying, or even if you're vulnerable or healthy, it doesn't pick, and it can actually affect anyone. And you may not even know it and can be infected, but remain asymptomatic. So when we come to a disease, a lot of us will actually look for this thing. What's this thing? Which is cure, right? It is what most of us will look for when we come to a disease. But when we look at COVID-19, we know that currently there's no cure, right? We do not really have the medication to cure yet. Yes, we can control it, but we do not have a cure. So how then do we want to overcome these things? Before I even introduce you a bit about this virus, right, I want to introduce this term between virus and bacteria, which I think is a very common questions that we get also. Perhaps it will help you when you go to see to the doctor next time. So because both virus and bacteria can actually be your causes of fever. So when you have fever, it doesn't mean that it's just bacteria or it's just virus. It can be either one, okay? But one of the main major difference, right, between a virus and bacteria is with bacteria, you actually need antibiotic as a treatment, and with virus, it's usually an antiviral or it's a self-limiting. So you would also understand that when you go and see a doctor for your fever, it doesn't necessarily mean that you will need antibiotic for each type of fever. Yeah, so this is just a basic information I think would help every one of you to understand further about virus and bacteria and what's this virus. So when we look at COVID-19, COVID-19 is actually a virus, as we all know it. It's from the family of corona. Why is corona? Because it has spikes on it. And how does it spread? How does this COVID-19 spread? So where there is people, where there is contact between human and human, coronavirus can spread. So basically, it spreads through three ways. One is through droplet transmission. So we know that anything that produces droplets, for example, like when you're coughing, when you're sneezing, or when you're talking very forcefully or singing very forcefully, you can actually spread the disease through your droplet transmission. And the second thing is through direct physical contact. You have direct contact with another person who is infected with the virus, because it can be on your skin surface as well, and contact with a contaminated surface. So these are the three main ways that how coronavirus, or what we know as COVID-19 disease, can actually spread. So by the way, COVID-19 is coronavirus disease, and it's actually found on the 31st of December 2019, and therefore you have COVID-19 as the name. So coming to this, how do we then overcome this COVID-19? understanding how it spread, right, will actually help us to process our thoughts, right, and know what are the mechanisms behind and why we are doing things a certain way. So I would like to introduce all of you to one concept which is very important, which I've turned the talk also to overcoming COVID-19 with the big P. And I think a lot of you actually have this question to me, actually, what is this P that we're talking about? And I believe that most of us know what this P is. And this P that I'm going to introduce to you is prevention, right? Prevention is better than cure. And I'm sure most of us also know and also heard of this before many, many times. But you see, when you look at this cartoon, right, this guy goes to a doctor, and this doctor tells this guy, says, the best thing you can do is to give up smoking, drinking, and fried food. I'm also sure that most of us have heard this before. So this person asked the doctor, then what's the second best? Yeah. So in this sort of situation, we always know what we need to do. We always know what is best. We know that smoking is bad for health. We know that we need to eat healthily. We know that we should exercise. I know, but I just can't. Right? This is our general human nature. By human nature, we will always choose something which we think is best for us. We know that this is good, but I don't think that I can change. But I want to challenge you and tell you that yes, you can. Health behavior change, right, comes with three things, and you need these three things, right, in order to help you to make these changes in a practical way. So the first thing is you need a certain number of knowledge. So coming back to this talk, right, this sharing talk will actually help you understand a bit about how the virus spread and why we need to do a certain way, the certain things. And this understanding will then help us to change our attitude. When we change our attitude, we will have a certain, we want to change, we want to do certain things because we know and we understand why we need to do it. But the change of attitude alone is not enough. And we have to find our own motivation of why we want to do it. So every one of us will have our own motivation, why you want to, why do you want to protect yourself from COVID-19? Or why do you not want to protect yourself from COVID-19? Why do I want to do certain SOP and why do I not want to do certain SOP? So just sharing with all of you, my motivation, because last year I was involved in the front line together with the COVID-19, fighting the pandemic, and this year as well. So my motivation when I come back from my workplace is I want to protect my family. And so what I do is I will make it a point that I will take my bath when I am in my workplace for last year, right? And in my workplace. And then when I come back, I take my bath again. So that was the sort of motivation that I have, which helps me to turn that into a practice. So you need the knowledge to understand. From the understanding, you will have a change of attitude. And from the change of attitude, then you have to find your motivation of why you want to do so. Some of you might have a different motivation. For example, I want to live longer, or I want to go back and see my parents, or I want to, I want to go and travel someday. Find your own motivation, so that will lead to a change in behavior and a change, and that will be changed into a practice. Okay, so when we talk about practice, right, practice is just something that you do repeatedly over and over again. So you think of it like when you're brushing teeth, right? You don't straight away know how to brush your teeth. You don't straight away wake up in the morning when you're a baby, right? And you know you need to do it. But it's through years and years of practice that you do it. Then you know that the first thing that you need to do in the morning is actually you need to wake up and brush your teeth. Yeah, so that's how practice works. It really needs you to go through the motion over and over again. So you need these three things to help you to have that shift of mindset. So just to intro all of you to this, before we actually go into the crux of the talk, which is the prevention. Most of us as humans, we start with no disease and being healthy, right? But at some point of time, you have the onset of disease and the disease will start to come in. But when the disease starts to come in, the onset of disease, you will have a certain period of time where you have the disease present, but you may not have a symptom, okay? But the disease is already there. It doesn't mean that it's not there, it's there, but you don't have the symptom. And there will be a point of time when you start to have the onset of symptoms. And at this point of time, the disease is present and you have the symptom. So a lot of times, right, you can picture it like that. When you have the onset of, even when you have the onset of disease with no symptoms, right, you're just like any normal ordinary person, and you may not know it that you're having it. And there's this thing called chronic disease and acute disease. We're talking about acute disease, we are talking about timeline of days or weeks, and we're talking about chronic disease is the timeline of months or years, right? So acute disease are things like your COVID-19 right now, okay, which it just takes days or weeks, and your chronic diseases are things like your diabetes, your hypertension, which takes months and years to manifest. So why knowing this is important, right? Because it helps us to align what this prevent is. So in public health, there's actually these 3 levels of prevention. And today I'm going to share with all of you what these 3 levels of prevention is and how we can actually use this to apply this to how we can actually overcome COVID-19. So the first level of primary prevention, the first level we call it as primary prevention. So basically, right, usually we use this mainly for your chronic diseases. So you can picture it something like your diabetes and hypertension, right? So your primary prevention is what you do before your disease actually starts. So you have no disease and you're healthy, so you practice your healthy lifestyle and you have certain vaccinations to actually prevent you from certain communicable diseases. This is in the point that I'm not talking about COVID-19, I'm talking about other diseases. So you try to look at it from that perspective. Secondary prevention, right, is when you have the disease, but you have no symptoms. So what you do at secondary prevention is you have early diagnosis and treatment, because you would not know that you have the disease. So you will have a yearly checkup, say, or you will do your blood test yearly. So whenever you have, the doctor pick up certain things, you will pick up early and have an early treatment. And your tertiary prevention is actually when you have the disease and you have the symptom. So what you do on the tertiary prevention level is you get early treatment, and because the disease is already present, we just want to stop it from getting worse. So it's treatment and rehabilitation. So today we're going to see how we can actually apply these 3 levels to overcoming COVID-19. And it's actually the sort of the same thing, because when we say chronic disease and acute disease just means that it's a matter of days. And what you do in these few days, right, actually matters a lot on how we can actually prevent the disease together. Okay, so I would like to bring all of you to the attention of this. When I look at this prevent, I'm sure this picture will actually be a very common scene for all of us. So what do you see? You actually see 2 people actually standing apart, right? Which is what we currently are supposed to do, right? So when we talk about COVID-19, we have to understand the transmission. How does COVID-19 transmit? So COVID-19 transmit through droplet transmission. And droplet transmission, because droplets, they are heavier. So when you have these droplets coming out from your respiratory system, right, and then it will actually drop down to the ground. After a while, it will drop down to the ground after it linger around in the air. So usually, how far does it go? It go about 1 to 2 meters. It rarely goes beyond 2 meter distance. But when you're talking about airborne transmission, it can linger in the air. So when it lingers in the air, you can actually get it further away from 1 or 2 meters, or when you are in a very confined environment. So usually your airborne is actually like your TB, your tuberculosis is airborne. But for now, most of the researchers are pointing to droplet transmission for COVID-19, although that in certain cases, in a very confined space, you may have some of these droplets lingering around for a longer period of time. So essentially, when you have someone which is within 1 meter distance, you are more likely to get infected with COVID-19, because that's how the virus is transmitted. So understanding how this virus actually works, right, will help you to understand why you are doing what we are doing now, which is social distancing. So we're not doing the SOPs just because it's an SOP, but because the science behind it says that If you keep a certain distance of more than 1 meter or 2 meter distance, and then you are protecting yourself from actually getting the disease. So if you can picture this in mind, right, you have someone in front of you, and the someone is very close to you and talking. So if you have the droplets coming out or suddenly cough in front of you, you can actually picture the COVID-19 virus coming out of that person. And if you are very close, you are more likely to get infected. But if you are further apart, then you are not likely to get infected. Yeah. So this is also why you have this XXX. I believe that you go to restaurants or any place, you have this XXX. This X, right, is to remind yourself to have this social distancing, and you need to keep the 1 meter distance no matter where you are. So when we say no matter where you are, right, it also means that it doesn't matter whether I'm having lunch with a friend, which I know very well, there is still a risk, because where there is people, there is a risk involved, right? Second thing, masks. Why do we wear masks actually? Do we wear masks because, yeah, we want to protect yourself, but how and why? So you see, when you look at this picture, right, when someone is coughing in front of you, say, and you are wearing a mask, and therefore this mask acts like a barrier or a protector to your mucosal membrane, and these things can't actually enter your lung. Okay, but what happens if you don't wear a mask? You are more likely to get infected. So the risk is higher when both parties do not wear a mask. The risk reduces when one party wears mask and one party does not wear mask. The risk reduces further when both parties are wearing masks. So if the person is coughing, right, you can picture that this virus actually can't come out from the mask, and it can't actually go through your mask as well. So wear a mask. That's our SOP, right? That's the SOP that you always and always hear. Wear a mask. It's not wearing a mask because you are scared of getting fined, but it's wearing a mask because I want to protect myself from it, right? And wearing a mask also means that you need to wear it properly. So it doesn't work if you wear so if you picture, right, your virus is on top of the mask layer, right, you will actually understand if you wear the mask at a certain way or below your chin, or you remove your mask and you just touch the surface of the mask, right, actually you are also putting yourself at higher risk. So it's not just the mask, but it's also wearing a mask in a proper way. So if you see the virus is on the mask everywhere, for example, simple things and practical things like when we remove our mask, right? I'm sure that we will just, when we want to eat, we will just put it somewhere. But there may be also a way to see how we can actually reduce the infection or reduce the risk of transmission. So when you remove your mask, it's better to close it this way. When you want to wear it back, means that the blue color one is outside and the white is inside. So later on, when you wear it, right, you are not really exposing yourself to whatever that's in your environment. But when we want to throw the mask, right, it's better to fold it in. Yeah, so then you won't expose whatever is outside that you have exposed to the other people or your environment. So the second one is mask. So the third one is actually hand washing. So this is also presumably what we are doing every day. And when we look at hand washing, I think it's we look at those activities that can increase our risk of infection. For example, handshaking, hugging, or rubbing your eyes, or you actually go and press the leaf daily, right? When you picture the virus is possibly there, how you can protect yourself is you can wash your hands. So when you wash your hands, you are actually literally protecting yourself from getting the disease. So it doesn't matter how many times you wash your hand, but every time you press the leaf, you sanitize. Every time you do something, you sanitize. And how do you prevent yourself from getting infected is you prevent yourself from doing all those activities, and therefore it actually reduces your risk. So sanitize and wash your hands. And the next thing I'm going to talk about is vaccination. Vaccination is something which I believe a lot of us are actually talking about it right now. But the thing about vaccination, right, is do you know that it's also part of your primary prevention? those who have not gotten the disease yet, you are actually protected by getting the vaccination because it helps your immune system. Your immune system needs to recognize the virus in order to come up with an antibody to fight off the virus. And what vaccination does is it actually mimics that process. So when you have vaccination, it sort of mimic the virus. It mimics the protein of the virus, so your body can produce a certain amount of immunity. And if you really get the disease, then it will help you to fight off that infection. But one thing I want to say for vaccination, which is very important now, it's to get the right information from the right source. Okay, we are faced not with just pandemic, we are also faced with this thing called infodemic. And that's now with the social media and with the internet and with all the source of information that we can get everywhere, there's just a lot and a lot of information to process, right? But it's very important for us to get the right information from the right source. Yes, vaccination is a choice, as some may say, but it's also important that you get a right information to inform your choice. So when we talk about vaccination, I like to bring your attention to two things. So one thing that we need to know is risk versus benefit. When we talk about vaccination, a lot of people tend to, because you hear a lot, right, about side effects and everything. So you tend to look just at the risk of getting vaccination and we likely forget about the benefit. But in health, right, we always look at a balance between both. So we weigh between the risks and the benefits. So there are some people who, because of certain limitations, they are not able to get the vaccination. But so for some people, they are able to get the vaccination, and you have to look at where your risk and benefit stands. So it's not just looking at, what are the side effects. Yes, everything there is a risk, but we also need to balance it between the risk and benefits and see which one outweighs the other. So when I talk about vaccine, two concepts that's very important. One is disease severity and one is the risk of infection. I think for easier representation, I will show this in this slide. So as long as there is people, right, there's always risk of infection, because remember that I say it's a transmission where there's contact between human and human. Human is the host for COVID-19. So as long as there's people, there will be risk of infection. And this is also why we have these SOPs, right? Avoid crowded spaces, avoid confined spaces, avoid close conversations, because these are the things that you will have a lot of people. And therefore, by preventing yourself from getting into that situation, you will actually prevent your risk of infection. Vaccination reduces disease severity. How does vaccination work? It reduces disease severity, means that if you get the disease, it will reduce your disease from severe to moderate, from moderate to mild, and maybe from mild, you don't even have symptoms to begin with. So yes, it's still possible for you to get the infection, because as long as there's people, there's risk of infection, but it will reduce your disease severity. And what does it happen? What happens when it reduces your disease severity, right? It also reduces disease transmissibility, means that how much the virus can actually transmit within your environment. So why? So when we look at this, right, you have an environment which you have a lot of sick and infectious people, and you're more likely to get it because when you have contact with someone in a same space, you're more likely to have the disease. But if you have more people who are immunized, you have more people who have less severe disease. Means that you can have disease, but maybe you don't have you don't have a severe disease, so you don't cough, you don't have symptoms, and you actually reduce the people who will actually be able to spread the disease and infection. And therefore, that will generally reduce the disease transmissibility. And this is what we call a herd immunity, which means that you need to have a certain number of people to be immunized so that they don't turn sick so easily. And in turn, it will help the transmission to actually reduce, and you will have more and more people who are not sick and not infectious at that point of time. So when you put it together, all these things are actually in your primary prevention: social distancing, washing your hands, wearing your mask, and your vaccination. And when you look back, right, this is just your SOP. This is what your SOP is. So when you understand how this virus transmits, you actually understand why do I need to do these things. So it's not just SOP because of SOP, but it's just what you need to do to make sure that you keep yourself from in a state of no disease and healthy before any onset of disease. So next, I would like to talk about COVID-19 testing. A lot of us are thinking about when, how, who should do all those testing. And we talk about quarantine. There's also always this question of when, who, and how. But before that, I want to bring all of you to this. What is my risk? Knowing your risk, right, will actually help you to see the testing and the quarantine in another different light. So what's my risk? So as a person, right, normal person, you, if you don't have any contact with anyone, right, generally you don't have the risk because you don't have any contact, right, and you start as a healthy person. And if you stay in the same house, one house, right, and you're alone, you're unlikely to get it as well because you don't go out, you don't go anywhere. But we know that generally it's not like that, right? So most of the cases, you have someone with you in the same house. And most of us have jobs, right? We go out, we work, and children go to school. And in between, you have things like, you go for lunch, you go for dinner, you go for meet up with your friends, and you may drop off your baby at the nanny's place before you go to work, and your children may take transport to their school. So this may form a daily routine, say, for family A. And you have also your weekend activities. So what are weekend activities? Maybe some of you may go shopping. You have your own sports activity. Maybe you want to go and visit your, parents or your grandparents, mother-in-law, father-in-law. And yeah, you have a family gathering, celebrate birthdays and whatnot, right? Maybe some of you go to church. And then, after church, let's go and have lunch or dinner together. And maybe there's certain death somewhere within your community and you attend on this funeral. So this may form some of the weekend activities for family A. So it only takes one, and we see why, right? If you are the index case and you're affected, right? You're infected now. Like I say, if you stay in the same house, if you stay alone in the house, right, it doesn't matter. So you won't actually infect other people. But it's seldom that way. And one of the people that you generally infect the easiest is your family members. Because why? Within your family, right, or within your house, right, you don't really practice your SOP, correct? You don't really wear your mask, you don't really keep your social distance. Presumably, sometimes you wash your hands, but you don't really wash as much when you're at home compared to when you're on the outside environment, right? So you can infect your family members, and family members are the ones that are most likely going to be infected. And your family members can actually go out and infect other people when they go out to have other contacts, okay? And when you infect these people, there's a second layer, right? You remember there's a second layer. So you also infect the people on your second layer. So the first layer is your daily activities. Your second layer is your weekend activities. If you still go around and do all those things as you normally do, right? And what happens if, a lot of times we always see this as a one-way ticket, right? So, so you look at my slide, right? From this, it's an index case, you know that it's from this family and it can actually spread outside, right? So you look at the transition, actually without realizing it, there's actually another layer outside which can actually form your index case. So when it is in the community, right, it just means that we don't know who is infecting who. So it can come from this index case, which is the yellow box inside, or it can come from your right-hand side, which is the index case from another case, and you will start cross-infecting each other. When it's in the community, you really don't know until you investigate each and every case. And you see from one, right, it only takes one person and you start to infect other people, other family around you. And from there, each and everyone has their own house. Each and everyone will infect their own community, and each and everyone will infect the people around them. So it only takes one to infect your community. And from that community, it only takes one to infect the district. So for example, you have someone who crosses the district, maybe for work related or whatever not. And when one is affected, you can actually infect the whole community. From one, right, it can spread like a wildfire to the community, right? It only takes one. And from there, it only takes one also to, you say you have a cluster somewhere within the state, and it only takes one person to go somewhere else, and you start another whole cycle of what we just went through earlier on. So it's very important to know where you are within the COVID-19 infection chain. So if you're a COVID-19 positive person, right, what you do is investigation will be done by the health officer, right? And what you know is you need to quarantine 10 days or until your symptoms is resolved, especially for those who are symptomatic. So the where you're going to be quarantined is usually determined by the health site. Okay, so it's very easy. And I think for A, when you're in the group A, a lot of people know what to do, right? But when you're in group B, what do you mean by B? B is actually when you become a close contact to A. So how do you determine who is the close contact? So close contacts are people like, family members staying in the same house. Why? Because it's unlikely that you're practicing the SOPs. Those who have contact less than 1 meter, why? Because droplets usually spread through a 1 meter distance. Those who have contact without wearing masks, especially more than 15 minutes, because the longer time you have contact with each other without masks, you are not protected, and therefore there's a higher risk. Physical contact, because the virus transmits through physical contact, like, hugging, touching, and if you shake hands, you're more likely to get it. And confined space more than 2 hours, because if you're in a confined space in the aircon, the air has nowhere to circulate and go. So whatever is in there, right, will probably circulate for a long time, and you're more likely to get the disease. So what happens when you're B, right? You're a close contact to A. So you're more like, when you're B, your list will actually be given to the health officers who are investigating the case of A. And what B needs to do, right, is get tested for COVID-19. Currently, the gold standard is still using PCR. So when you get tested, right, two things actually happen. So if you're positive, right, B then becomes A, correct? And then you will start the cycle all over again. But if you're negative, right, you actually also have to quarantine for 10 days from the day of exposure to A and monitor your symptoms. Now, this is where I think we need to really, really understand the why, because it's not just getting one negative means that I am negative. So if you remember this, right, we start from no disease, healthy. We may have disease but no symptoms, and we may have disease with symptoms. And for COVID-19 is usually in the form of days. So it's a form of 10 days by research. Now we are thinking it's more likely that the incubation period is within this day. So you can have a contact, so incubation period of 10 days. So you can have a contact with someone who has the virus. You may not know the person have the virus. And on day 2, you start to know that this person have the infection, and you get tested on day 3. You maybe get your results negative on day 3, and you start to go out to work, and you start to contact with the rest of the people. But remember, right, you're still within the incubation period. And by day 8, right, you suddenly have symptoms of coughing, and you go and repeat your PCR, and you have found that you are positive. So when you reach this point of time, right, by the time if you go out on day 5 and you start contacting other people, day 5 to day 10, right, those who you have been in close contact will then become your B. So therefore, when you look at this side by side, this makes a lot of sense that why you need to quarantine for 10 days, even after you are tested negative initially, because you will need to monitor your symptoms and to make sure that within the 10 days, you actually do not develop new symptoms that may mean that you already have the infection, because the virus can be in your body, but it doesn't manifest yet. So disease present, no symptom. It can be this sort of state. Okay, so when you are B, you are contact to A. So what you do is you quarantine for 10 days, you get tested, and then you quarantine 10 days from the time of exposure to A and monitor your symptoms. So then what happens to C? So C layer, right, is a close contact to B. So A is the positive one, B is the close contact to the positive one, and C is actually your close contact to B. So now what happens to C? So close contact by definition, you use back the same definition. But when you fall into C, right, what you need to do is self-quarantine, and you actually need to wait for B's result to come out. Because if B is positive, B will become A, and you will be upgraded to become B. And therefore, you have to practice self-quarantine until B is negative. So when I say it's negative, right, it actually also depends on this cycle. Because say that B has been negative on day 5, but B still has to quarantine until day 10 because the status is unknown, right? So it's actually safer for you to have the self-quarantine to be sure that when B is confirmed negative, you are confirmed negative as well. Yeah. So this is something that we need to always know where you are in the cycle. So whether you are A, whether you're B, and whether you're C, and always get the updates on your close contacts. So if you're C, self-quarantine until B is confirmed negative, and if you're D, you become a close contact to C. And what happens to D? So for D, right, just know your risk, okay? Because any point of time when B is positive, C becomes B and D becomes C. So it's like a cycle. You can have D, E, F, G, and so on and so forth, but usually it's confined within this A, B, C, D. So A, B, Cs are the ones that you need to be very careful of in quarantine, but the D contact will need to know what happens to your subsequent, what happens to your earlier contacts. So when you put this together, right, these are actually your secondary prevention. You start preventing it even before, let's say, even if you have the disease present, you start to actually quarantine them and make sure that when you get it tested, when they have any symptoms or get tested and then you detect, because some of you might be a contact and you have the disease, but you do not know, and you only get to find out when you have your contact is positive and you take the test and you found out that you have the disease. So a lot of you may actually fall under this category. And the tertiary prevention category is when you have the disease present, but you also have the symptoms. So it's important if you have symptoms to get medical treatment as soon as possible and to practice self-quarantine. Means that any point of time where you think that you have a certain symptoms and you may suspect, go to the hospital immediately. You may need to get tested and practice self-quarantine. So when we talk about tertiary prevention, right, we're talking about prevention when you have the disease, but you don't want it to turn to severe disease and you don't want it to cause a lot of death. Okay, I'm sure that we're seeing all the deaths numbers rising daily, and this thing called overcrowding of hospitals and ICU beds. But what we are not seeing, right, and perhaps this is to share from the health viewpoint, what we're not seeing, right, is hospitals does not only have COVID patients, we also have, heart disease, your kidney failures, your trauma, your cancer, your stroke, your diabetes. You have all those patients who are also fighting for the same hospital and ICU beds. And when you have COVID-19 coming in, right, you just crowd the area, and these people might not be able to get attention as much as they need. So when we are talking about overcrowding of hospitals and ICU beds, we are not just talking about COVID-19, but we are also talking about other diseases, which does not stop just because COVID-19 is here, but it may get worse because COVID-19 increases the risk of infection. And therefore, when we talk about ICU beds and hospitals, remember that it's not just COVID-19 that we are preventing deaths, but we also want to prevent deaths from other diseases as well. So I would like to bring all of you to this slide. So this is my last few slides here. If you look at this traffic light, what do you think? Or what do you see? What do you feel? I'll give you a scenario. If you are at the traffic light, this is early in the morning, there's no one looking, right? And you're driving your car. So you stop at the traffic light and it's red. You look to the left, you look to the right, there's actually no cars there. So what do? Do you go forward? Do you, you know that red, you're supposed to stop. Do you really stop? And why? So actually what how we decide, right, is actually based on risk, right? If you choose to run the red light, you know, because it may be because that there's no police around, you know, there's no one around, and I know my risk because I'm not likely to get caught, and I'm not likely to get into an accident because I know my risk. Right? But if you stop, you also know that there may be a risk that a car is coming from somewhere that I do not know, and I know that I shouldn't run the red light, so I should just stay there because of my safety. So a lot of things, right, it depends on how we look at things and from what perspective we are seeing. So it's the same with COVID-19 and your SOPs. So just now, we repeated over and over again, where there is people, there is risk of infection. Where there is people, there is risk of infection. And when you look at your SOPs are actually helping you to prevent these risks as you contact in people. Because where there is people, there is risk of infection, right? But we also need people to be able to practice all those SOPs together to prevent at the same time, because it only takes one. And if the one can actually do your part and empower the people around you to do the same, then we can actually do better in reducing the risk of infection. And this is breaking the chain of transmission, because once we reduce the risk of infection, we will reduce the overcrowding. We will reduce the people who get infected. We will reduce the people who will need to be admitted to the hospital. We will reduce the overcrowding. We will reduce the infections that is going to, the people that's going to be admitted to ICU, and we will reduce deaths. So it only takes one, but it also can start with one. And when one do, one see, one do, and one teach the other to do, we can do more than what we are doing now. So I would like to end with this. I like this quote, actually shared by one of my bosses when I was working under the occupational health department. So prevention is inconvenient, is very much inconvenient, yes. Is washing hands 10 times a day inconvenient? Yes. Is taking bath 2 times a day or 10 times a day is inconvenient? Yes. But yet it is necessary, because only with prevention that you can make sure that you will stay in the state of no disease and healthy. Prevention is not waiting for something to happen, then we start to do something, but prevention is doing something before that thing happen. Yeah, prevention is not waiting for something to happen and we do something, but prevention is doing something before that thing actually happen. So life is about choices, and every choice you make makes you. And I hope you remember this. And when you look at this SOP, I hope that through this sharing, you will see SOP in a different light, why, and understand the whys of the SOP and why you need to do it. And no one is safe until everyone is safe. So with that, I will end my sharing and pass the time back to the moderator.
Okay, we'd like to thank Dr. Calyn Tan again for the very informative sharing. Yeah, so we have come into the Q&A session. So far, we have not have anyone typing in the chat box, or we have not have anyone from the Facebook Live, yeah, commenting or asking questions in chat. So maybe I'll just open this time to those maybe who would like to raise your hand to ask questions. So is there anyone who would like to, through Zoom, raise your hand to ask any questions verbally? You can do so right now. Please remember to press the raise hand button.
Yes,
Sorry,
I have a question. I have a question here.
Okay.
Okay, we go back to the part where B is supposed to quarantine oneself for 10 days, right? Even though the first test is negative.
Yep.
Okay. So let's say I'm in the C category.
Yes.
And during that period, I did not have any more close contact with B. And in any case, if B actually was to be tested positive after that, within that 10 days, what is the possibility that I will get infected?
Okay. Thank you for the question, Elsie. So usually we go by exposure. So if you have a very recent exposure, for example, like your exposure is just yesterday, and then today, then you know that the person is positive, right? B is positive, and then B is negative. So I would advise you to actually continue your quarantine period because it's recent and it's still within the 10 days. But say your last exposure with B is 8 days ago, right? And you only got to know that B is positive, like maybe on your 9th day. And by then B is still negative. Then that's not very likely that you're going to get infected from B. Usually we look at it from the point of the recent contact, and also the transmissibility is dependent on the recent contacts. Yeah, it's more dependent on the time base. So if you're on like I met B 8 days ago, 9 days ago, then I know that B is negative, and then I can be quite sure that actually I am actually okay. Yeah.
Okay, thank you.
Welcome.
All right. So we have a question in the chat box from Zen X Hannah. It says here, may I know what's your opinion about AstraZeneca? Does it have a huge risk for women with an age range of 18 to 30?
Okay, so thank you for the question. So for the vaccination of AstraZeneca, right? To be very honest, I haven't really read on the data yet, but I believe that when we look at risk, or we have to actually, we can't take it from one particular information. We actually have to look back into the data in a very scrutinize the data and analyze it. So perhaps I would refrain from commenting that because I haven't really looked into the data from the AstraZeneca side. Yeah. So anyway, when we're talking about risk, remember that we also need to talk about benefits. And if there's any doubts, it would be good to actually talk to your healthcare provider on that before you actually use the vaccine.
Okay, thank you, Dr. Calyn. And we have a question from the Facebook, from HW Chi. Said that current vaccines like Pfizer or Sinovac, how effective are they against the new variants, like for example the Indian double mutant?
Okay, so for this, right, for vaccines, right, it also, for the current vaccines available, we have data against the previous variants, but the same as the question for AstraZeneca, it requires us to go back to more data to actually look at how effective it is against the double variant mutant. And I have not personally gone into looking at that yet at the moment also as well. Yeah. So I would say that we would need to see more data, and we need to analyze it further before we can actually make any comment on it.
Okay, right. And we have another question from Julian Gunn. Said that assuming a person goes for the second swab today, but the person is not required to quarantine and somehow goes to interact with someone else after the swab, and when the results of the swab comes out, is it still relevant? Thank you.
Can you repeat the question again?
Okay, it says, assuming a person goes for the second swab today, but that person is not required to quarantine, then somehow it goes into interact with someone else after the swab. So when the result of the swab comes out, is it still relevant?
Okay. yes, because actually when you take swab, right, you're not supposed to, when you take swab, you know that you are waiting for a result, and therefore you know that you need to quarantine. So that is the general rule to say that you don't need to wait for people to tell you that you need to quarantine, because when you're waiting for the result, you do not know whether you are going to be positive or negative. So yes, the result will still be relevant, but that will mean that you will have more and more contacts to be screened, because then you go interact with other people. Yeah.
Okay.
Mm.
Thank you, Doctor. And we have a question from Pauline Koi. Says, in terms of the situation now, would you advise we use N95 with FFP2? I think this question is in relation to mask.
Okay. I'm sorry, I'm not sure what FFP2 is at the moment, but for the moment, for N95, right, it's only recommended for the health side, those who are actually involved in caring for patients. So for the general public, is still using masks, face masks. But anyhow, in order to protect yourself, it's better to I just want to say that there's no one SOP, one thing that you do works. It actually requires you to do a few things together. So if you practice the SOP as it is, for example, you wear a mask, you wash your hands, you know your risk, and you reduce your non-essential activities, you only go for essential activities. And even if you are, let's say, going out to buy food or buy groceries, you don't actually need to go out 1 week 7 times. You reduce all those things, then that will actually reduces your risk very much. Yeah. So in that, yeah, I would say the current, I'm not sure what FFP2 is, but I will later find out and address it later. Thank you.
Okay. Okay. Is there any more questions from anyone? Anyone who would like to raise your hand to ask question verbally? One more? Yes. I think we have question coming in from the Facebook partner. Okay, there's a question from Maggie Lim. Is there any medication that we need to stop taking temporarily after our vaccination shot?
Stop taking temporary. Not that I know of at the moment, but usually what we do is the means that we have if you're taking any medications, let's say you're on certain medications that may reduce your immune system's availability to fight off any diseases, for example, like steroids, then that may mean that you will need to withhold your vaccination. So perhaps if you're talking in terms of that, then yes, that sort of medication, and it's best to actually for you to go back to your doctor. And another medication that you need to perhaps be very aware before you take the vaccine, not after you take the vaccine, is if you're taking warfarins, for example. So because this is an intramuscular injection, and if you take warfarin, it's more likely that you will have bleeding. So if you're having warfarin and if you need to take the shot, you need to let your doctors know as well. Yep. But in terms of whether there's any medication that we need to stop taking temporary after our vaccine shot, it's best to still go back to your doctor, because there may be certain medications out there that may reduce or may have may reduce your your immunity or your the vaccine efficacy of it. Yeah.
Yeah. Okay. Or even though we are over time, but because we allow about 10 minutes after 4 o'clock, after 4 p.m. for questions,
Yep.
So we still have 2 more questions. One from Julian Gunn. He said, can you clarify whether it's true that wearing face mask causes breathing difficulties? People seem overly worried about this. Thank you.
Usually, okay, thank you for the question. So usually it is not, because if you notice that face mask has a certain breathability, and usually it does not affect your change of oxygen or carbon dioxide per se. But what it does is maybe some people will feel that you need more effort when you wear mask, especially when you are doing a certain types of activities. For example, like you're running, you are climbing stairs, or perhaps that will actually affect some people. And it also depends on what mask that you are using and how the mask actually fits on you. So usually it does not, it may be related to maybe certain people who will have certain respiratory disease, for example, or heart disease, may feel it more, but in general it does not. Yeah.
Okay, and just a very quick question again from Pauline Koya, because she asked about the N95 or FFP. What about double mask? What's your view on this?
At the current moment, not that I am aware of that we are practicing a double mask policy, yeah, at the current moment. But I would also need to look into further on the mask, because at the current moment the guideline still says that it's one layer mask. Yeah.
Okay. All right, and we have a question from Linda Liu. She said, after taking the vaccine, can a person straight away go to work, especially engineering site work, or need to rest for a few days? And then also, how about especially to those who are having diabetes?
Okay. So if after taking the vaccine, right, usually you are monitored for 15 minutes. And after 15 minutes, if 15 to 30 minutes lah. So after 15 to 30 minutes, if you generally do not have symptoms, you are okay. And everyone's body actually reacts differently. So actually it's okay even after 15 to 30 minutes, you can start doing your things like normal. But if any point of time do you have any symptoms, then you can actually report it through MySejahtera, and you can actually go to your nearest hospital to seek treatment if there's a need. But in general sense, most of them can do all the activities as usual, just right after the 15 to 30 minutes of your taking your vaccine.
Okay.
Yeah.
So question from X Hannah. I have a parent who is stage 4 cancer patient and have gone through chemotherapy and immunotherapy. Is it safe to take the vaccination?
Okay, so for those who are taking immunotherapy, perhaps you need to see whether they are taking it now or they have been taking it previously. So if they have been taking it previously and now they are not on it, then yeah, they can actually take the vaccine. But if they are actually taking it now, I think you need to speak to your doctor's concern, see whether they will actually allow them to take or not. But because as I say, for those who are on the low immunity side, we will be more concerned on that. But if you say that it's a previous one that is completed the cycle, then yes, you can usually take the vaccine. Was there a question that I did not answer previously? The repeat.
Which one?
Before, I think before this question.
Before this question, the one diabetes, is it?
Yeah, on diabetes,
after taking
right?
Yep.
So usually diabetes doesn't affect those with diabetes. Yes, you can take the vaccine. Make sure that your diabetes is in good control lah. And the only thing that you cannot take is when you have acute disease at that point of time. For example, at that point of time, you're having like chest pain or sweating, or you have other symptoms. But otherwise, if you're on normal diabetes and it's well controlled, then actually, yes, you should take the vaccine as well, because you are also on the higher risk side. Diabetes lowers your immunity system and it's more likely you can get the infection. So getting the vaccination will be a form of protection for you as well.
Okay. And last question from Patrick Tan. Says, I have heard of people who come into contact with COVID positive cases, but after going for a swab test, they are negative and they do not quarantine themselves. What are your thoughts?
So after swab test, they are negative and never quarantine themselves. Okay. Yeah, so that's why this sharing, I guess. Because I guess maybe some of us may not understand fully why the need for quarantine, why we are doing things a certain way that we do. So it's very important for everyone to be able to understand the need for quarantine, when know where you are in the infection chain, your A, your B, your C, your D. And if you fall in any of this category, you will know that you will definitely need some form of quarantine. How long, dependent on how you're exposed to the person, and what kind of exposure. And if you look at the list of things that are close, how we define close contacts, right, is actually if you practice your SOPs as you do, you are less likely to become a close contact. You are less likely to fall into that category because you wear masks, you practice your safe distancing, you don't go about meeting people so much, and the only risk that perhaps you can have is with your family at home lah. But that also, I think you can do certain things to reduce the risk. So another thing maybe I want to add is that when you would think that it's only likely that you get infected because you go out, right? But it's also likely when you are staying in a family of different people, because different people come in and go out at different time. So everyone actually has a risk of infecting everybody if everyone is actually on the go. Yeah.
Okay, so yeah, so we would like to really thank you, Dr. Calyn Tan, yeah, for having such an informative sharing to us, because to let us really know when we understand the why and the hows on what COVID is, and that's only how we can really learn how to defend ourselves by preventing this disease. Yeah. So I think my favorite part is to say that once we have the knowledge, then we can be able to understand it, and then we can have the attitude change. And then this will also motivate us, yeah, to put it into a practice. So I hope everyone who listen, who join us today, who listen to this talk, can benefit from this. And there's an English idiom saying that knowledge is power. So don't keep this knowledge only to yourself. Now we put it into practice, we share with other people, and hope that other people are also being aware from this. And yeah, let's everyone work together to combat this. Okay, so kita jaga kita. So that's it for the session today. We thank you again for putting your time to join us. We hope that you benefit from this talk. So we wish everyone a pleasant evening.
Thank you very much.